Born to no return, born to no return. Welcome back, man. We know too much, man. We done seen too much. We've been through too much. We are experiencing way too much, man. God to reveal himself to us over and over again for us to go back to the way we used to be, the way we used to think, react, and respond to life, man. It's your Holy Ghost homeboy Slim. SLIMM, simply living in my moment, which means yesterday is gone, tomorrow's never promised. So all you have is right now, this moment, and I hope you're fully living in yours because I'm fully living in mine, man. Just back with another quick word, man. What is mental health, man? A lot of people get it confused, but really it's like, whether it's internally, meaning that you inherited this, meaning that you developed this and it was a result of internal things that were going up and you developed this disorder, disability, or illness, or external trauma or situation or medicine or reaction or something like that, or accident or any of these things that can cause a disability too, right? Regardless, right? At the basis of it is when your thoughts, feelings, or emotions are at a point where it distorts your reality and it makes where your decisions that you make, you lose rational reasoning skills, critical thinking skills, and you make decisions that are not of norm. You know what I'm saying? It's a lot of people that play like they are sick or like they are crazy, for another word, I guess another term. But only a small percentage of people that are actually in these places, these hospitals, or in this world, in this population, in our communities, only a small percentage of the people are actually truly sick, truly ill. You know what I'm saying? And that means that they do not care about the person, place, time, event, thing. They're gonna do what they do, say what they say, and then they don't have control over what they feel, think, or experiencing at that time. That is their reality. And a lot of people that are ill and that are sick, they will tell you that they are crazy. So a lot of crazy people, you feel me? For, I guess, a lack of a better word, I don't like using that word, but a lot of people that are ill, that are sick, that say that it's conditional and situational. Feel me? Because if you do something to you, if you do something to them, they'll tell you that what you're doing. You feel me? Then they'll tell you, you feel me, what the laws are and what the rules are, what the regulations are. They'll check you for real. They know the black and white, they know the policies and procedures, and they use it to their advantage. And then they come in, and I've seen people come in and they get a check for doing this. So they got to come in a certain period of time, every couple months or every month or whatever. They got to have these hospital visits and these appointments done and made, and these stays in these places checked off so they could continue to get their funding. And that's how some people live. That's how some people eat. And then you got a lot of people that are experiencing, homelessness. Excuse me again. And they use these facilities and these places as a way to have shelter throughout the year. You know what I'm saying? And I don't blame anybody. You know what I'm saying? I don't look at anybody anyway or judge anybody, because I felt like when I was working in those areas, if you was brought to me, you was brought to me for a reason. So it's my job to take care of you and to bring you the light. So if you're there, I'm there in order to intercede and just be whatever God need me to be for them or for you at that moment. Then you have people that, again, truly sick, small percentage. These are people that no matter what, like I've seen people who have husbands and kids and families and come from wealthy backgrounds, and they are educated and all these things, and yet they're in a facility or a hospital or some type of behavior institution 7 months out the year. Nobody in their right mind is going to choose to be in a place like that, because if we know what these hospitals and what these facilities are actually like, then we understand that it's the same rules go as a prison or a jail. You know what I'm saying? A lot of the workers are lazy. A lot of the workers are out of shape. A lot of the workers are spoiled, and they also manipulate the system in the fact that these people are not in their right mind sometimes, and they not in the best positions physically to be able to really speak or defend themselves. So a lot of times the worker take advantage of the situations. They neglect them. They don't listen to them. They really not there to help them. They are there to make a check, make a buck, clock out and go home. They're not there to really change anybody's life or be an assistance to get these people to a better place. You do have people that are also in crisis, and they do need that stabilization for that moment. You know what I'm saying? So that's why it's important to be the right person in the right place at the right time to show people, hey, like, we going through real stuff. So you supposed to be coming here to get help wherever you come from or wherever you here. You know what I'm saying? Whatever brought you here. I don't want to compound your hurt or your trauma or anything that you're going through with my BS or with my attitude or with my anger or with, you know, whatever. People power tripping, and they get to these places where they have no control in their personal, and they realize, but they get to work and they have a title or position or some say so, and then they abuse that privilege because that's the only power or control that they have. So everybody is dealing with something. Everybody hears multiple voices, have different influences. Everybody have different moods. Everybody have different personalities, different sides. But some people are very extreme, and again, it distorts the way you see reality, and then it changes the way you act, and it makes you act at a norm. That is mental illness, that is mental disorder, a mental disability, however you want to put it. How do you combat this hurt, this trauma? How do you combat this addiction? How do you combat these things, these demonic and spiritual warfare, and these things that people are going through internally with their soul and with their heart and with their mind? How do you do that in a week or 2 weeks? How do you do that with a pill? How do you do that with these fake groups and these programs that they have that are ineffective, because half the time they just watching TV, playing bingo, you know, listening to music. They're not really doing anything that is really helping them or bringing them closer to the best versions of themselves. A lot of time, again, the people that's truly there that need help, what we trying to do is just stabilize them mentally and medically and get them back to their baseline, to where they're able to think appropriately in order to be themselves and go out there and be functional in the world. A lot of people get trapped in that world because in that environment, you can cut a fool. You can be who you want to be. You can lie. You can fight. You can hurt people. You can spit. You can do sexual stuff. It's a place where you can really lose control, and it's not accepted, but it's what come with the territory. It's like you can use that as an excuse. Well, you already think I'm crazy. I'm in a crazy house. I'm in this place, so I might as well act a part. You know, when in Rome, that's the idea again. When in Rome, you know what I'm saying? I've seen a lot of people that's not like that, but then they get in these places or the environment, workers and patients, and they will change and be whoever it is that's there on that clock that day. You know what I'm saying? And then you see them outside the building, and then you see they're a totally different person. You know what I'm saying? So again, how do you combat this? How do you really attack this if nobody is really really want to work in this field? A lot of people come to this field because they don't have a lot of jobs that's hiring, you know what I'm saying? And then these jobs, nobody want to do this job, so the turnaround rate is high. You know what I'm saying? It's a recyclable door, you know what I'm saying? It's a revolving door, you know what I mean? So it's one body, they just replacing one body with the next, one body with the next. They don't care who on the clock, as long as somebody on there and you can take responsibility or accountability for what goes wrong. You know what I'm saying? That's all they care about. Then you have a lot of nurses and a lot of doctors that are not professionals. They're not people persons either. They're not like, they don't have bedside manners anymore. They're not there to really listen to the patient. They're there to read a script. They're there to assign whatever medication is high, whatever pharmaceutical company that they made a deal with to push their medication through these hospitals and introduce this medication to their patients so they can increase their revenue and increase their customers. That's who the hospital use. So I'm saying whatever is hot at the time, it don't matter if it work or don't work, that's what they gonna push. Whatever is going on, that's what they gonna say. It's like they read from a book. They not really going from person to person. And then a lot of times they get jaded because they see the same people over and over. So they're not able to be like me. I don't care if I see you 100 times, you know what I'm saying? I'm just glad that you're alive. I'm just glad that I got an opportunity to help you again. I'm glad that you got a safe place to stay. I'm glad that you got somewhere to eat. I'm glad that, you know, if you need some clothes, we got a little thing we could get you clothes. If you need, you know what I'm saying, protection or just a breather from life, you able to be here and you protected and nobody can really come here and hurt you or bother you as long as I'm here, as long as I'm you know what I'm saying, you allow me to help you. So that's the position I was in. But a lot of people not like that. They see the same people, so they just tune them out. It's in one ear, out the other. And a lot of times these people, again, they continue to abuse their power and their privilege, and they don't do the work that they're supposed to do. We supposed to be there to help people, and then they say that I care too much. We dealing with each other. You know what I'm saying? We're not dealing with machines or anything like that that doesn't have feelings. We dealing with people. We dealing with mamas, daddies, brothers. You know what I'm saying? That could be any one of us. And I used to tell the patients that, like, ain't no difference between me and you. In fact, they treat me worse than you. You know what I'm saying? So I used to make sure that I respected every individual, first and foremost. And then I didn't treat them like a patient. Second, I treated them like a person. I used to always say, I don't want to treat you like a patient. If I'm treating you like a patient, that meant that I was unable to be a person to you. So now I have to do my job. Now I have to do the things that I put in place in order to protect me, to protect yourself, and to protect others. You know what I'm saying? Third, I listen to them. In order to help somebody in a mental health battle, you got to get to their soul. You got to get to the root of the problem. If you don't address the problem or address the situation that's keeping them stuck in a cycle, then you can't get to their mind to click, to stop and be still for a second and understand that, hey, it's a better way. That situation is done. Or if you've gone through it, yes, I'm going through a situation that I may not be able to handle, but I know that there is a better day. It's a better way. It's more to my story. This cannot be my end. This will not be my end. This is not me. I know that I can do better than this. You know what I'm saying? So you just keep that at the forefront of their mind. Then you got to beat them at whatever level they at. You got to respect people for who they are. You got to let people open up. You can't just treat people any kind of way because we in these facilities and we got some type of position or some type of pull, and you just think you about to tell another grown adult or a person, even if they're a child, what to do, and you think they gonna listen to you just because you're supposed to be authority figure because you're working at this place and you got this fake plastic badge on. You know what I'm saying? Nah, I respect everybody. Sometimes people need time alone. Sometimes you could get to people through music. Sometimes you could get to people with sports. Sometimes you could get to people with, you know, you got to see what they're interested in and see what they are. But how I do, I just keep it real. I just be myself. I always make sure that I manage the environment. That's one of the things that you can always do. The first thing that you can do is manage the environment. Make sure it's clean. Make sure the temperature is comfortable for everybody. Make sure that you are replenishing like they snacks and like they day room, especially make sure that's clean. Wipe down the tables, wipe down the chairs, because a lot of times janitors and the people that really clean their place, they don't really work just directly in that area. So they clean up one time in the beginning, one time in the end, and then they gonna move around the rest of the building. So you as a person, we only doing 15-minute checks, and we do our vitals. We make sure they get their meals, their phone calls, help doing med pass, and when the doctor come, we make sure that that's moving smooth. But a lot of times we got a lot of downtime. So instead of me gossiping or going into the nursing station or flirting or try to break up a happy home or start something or, you know, any of these things, man, I stayed with the patients. I did my job. So I would use a lot of my time to clean up. And then that's why they will respect me so much, because they see what I'm doing for them. I'm putting them first. I would make sure their coffee was hot. I would make sure if they needed their food warmed up, I would warm their food up. Even when they brought me their clothes, I treated them with respect. I not only washed and dried their clothes, I folded their clothes and brought it to their room. You know what I'm saying? I make sure I do everybody by name. I treated people like an individual, so it woke them up. When you stop treating people like a number or like an illness or their condition or whatever medications or symptoms or signs that they showing that you aren't used to, you know what I'm saying? And you start looking at them at it wakes them up. You got to wake their soul up. You got to wake their heart up. You got to wake their mind. You got to bring them back to life. You got to bring them back to reality. And it takes a real person to be man enough, a woman enough, to be vulnerable enough, to be both professional and personable, to be able to get those things across and still be able to work within the guidelines in order to keep your job safe and keep your name clean. But you also having a heart, you also having kindness, you also showing gratitude, you also showing mercy and respect and loyalty. Like, you know what I'm saying? Like, you making sure that these people are smiling. You making sure that these people are eating, and you got to go out your way, man. I had to cut some toenails. You feel me? I had to change some people. I ain't gonna lie to you. I had to, you know what I'm saying, just do things that you wouldn't do on a normal day-to-day, but that's what these people needed at this time. And like I say, you never know what you will go through. So you laughing and pointing at these people and calling these people crazy or out their name, who's to say that you ain't gonna go be in that situation? You got to think about how you treated these people when they were unable to really defend themselves. How did you treat them? How did you treat them? You feel me? We all gotta go one day. We all gotta be sick, you know what I'm saying? Go through these things where we gonna need help basically from somebody else. So you want to make sure that when the people are under your care, that's what you do. And then I just keep attacking the heart. I just keep attacking the soul, and then the mind opens up. And then once you get their attention, now you can get to the mind. Now you can get to the learn, but it's only so much you can do in a short period of time. But what you do is just plant that seed just to let them know that, hey, somebody see you, somebody care about you. I'm crying with you. I'm hurting with you. And then you got to be man enough or woman enough to call them out. I used to call them out when I knew they was faking. Oh, I used to call them out. Stop acting the fool when you know what's going on. Stop doing this. You ain't got to do this. You know what I'm saying? In order to survive or live, like, we got to find another way there. Like, this ain't it. And I was also man enough to apologize when I was wrong. I didn't feel like just because I was an authority figure, just because I was working, that I was right all the time. No, I would be the first one to say I'm sorry and I apologize, and then I was not physical with them. A lot of people come in and they threaten them with physical, or they threaten them with violence because they know at any time we could gang up on them. You feel me? They got medication, they got restraint rooms, they could strap them down, they got, you know what I'm saying, all type of things that they can make it uncomfortable. And some people use these methods as punishment instead of a consequence to their action, which is when you are unsafe to your other, unsafe to yourself, you feel me, or you just at a point to where you're uncontrollable, and that's the only way we can do is to medicate you in order to calm you down, to bring you to a place where you can sleep it off and bring you back so you can have clarity and get back to your baseline so you can think clear. But if you're doing these things just out of sheer thrill or just because you can, that's evil and that's mean. And it's a lot of people that's like that. I done seen people expire and it was in the hands of, you feel me? You feel me? And I seen them go to court and they be dishonest and they cover this up. I didn't seen them do this, like, you feel me? So that's why they couldn't have me around, because I was a for real mandated reporter. I was for real with them, for real. And I spoke on their behalf and I articulated what they couldn't. And then I stood in the way and I didn't let just anything happen to them. You know what I'm saying? And you got to understand that if you go through something, you know what they going through. So there's a lot of people that work in these places that got problems similar to them. We just got control. We just functional. We just, you know what I'm saying, able to come in the world and act accordingly. But we got some of the same issues and things that's going on. So use your experiences to help them. You supposed to give game. You know what I'm saying? Don't withhold information or a way to help somebody just because you might feel shame or embarrassed. It's a way that you could talk about your story without exposing yourself or exposing others. You could put it in other forms. You could put it in, story form where you could put animals as people, anything, just be creative. You know what I'm saying? But really, that's just what I do, man. I just attack the soul, attack the heart. I attack the root of the problem, get to the issue. Let's address that first. And then that's how you can move on to the future. And guess what? Sometimes you're going to work. Sometimes it's not going to work. But at the end of the day, people are going to remember how you made them feel. They might not remember your name, you feel me? But they gonna remember how you made them feel when they was under your care. So it's a lot of times when I'm bumping into people and patients and clients that I've had under my care, and they give me hugs and they still thank me to this day, and I thank them because they helped me grow up and become a man, and that's what kept me humble. That's what kept me so thankful and close to God, because it was like I had to be a light in a dark place, and then it just make you appreciate where you are. And it's like you don't want to trade your problems for somebody. I don't want nobody to have my problems, and I definitely don't want to deal with nobody else's problems. So it just keep things into perspective, and then it just makes it easier for me to deal with myself, because I was being able to basically be educated for free. I feel like I got a doctor's degree in psychology and medical, you know what I'm saying, nursing, all these things for free, just by me being dedicated to the job and me being actually interested in the person, You know what I'm saying? I ain't see the patient, I saw the person. But like, mental health is basically, again, man, like your inability to control your thoughts, your feelings, or your emotions, and it distorts your reasoning, critical, and just thinking skills in order to make competent, rational, reasonable decisions in order to be considered norm. You know what I mean? And trust me, it's a lot of people that are dealing with issues that refuse to admit it, that refuse to get help, that refuse to do the right thing. You know what I'm saying? And those type of people you can't really feel sorry for, because they understand exactly what's going on. They understand exactly what they do need to do in order to get better. And a lot of times we mentally ill because our soul's in the wrong place, and our heart in the wrong place. And a lot of time, if we could get over our trauma, get over our past, get over things that we've done and things that we've done to other people, we wouldn't be trying to replace our reality with these things to numb it, or to darken it, or to quiet it, or to mask it, or to hide it. A lot of people just don't want to go through what they need to go through in order to really become better. You know what I'm saying? It is a scary process to evolve and to accept where you are and what you've done, and then you got to figure out the work you need to put in, and then get up really and do it every day. And not only say it, but actually do it. So it's a lot of people that are just lazy, and they think that things are going to come just in one day, 1 week, just from taking this pill, just from saying this prayer, just from going to this beat, and just from, you know what I'm saying? No, you got to do everything, and you got to be consistent, and you got to, most importantly, stick with God and let him do it, and let Christ do it, and let the Holy Spirit. So a lot of people have that detachment from God because they think that they're going to get a consequence, or, you know, they're going to get shamed. No, God is there to clean you up. He's there to correct you. He's there to, feel me, fix you. He's there to relieve you of your mental illness or your disease or your discomfort. That's what he is. You know what I'm saying? So you got to first go to him. And then when you get right with him, then it allows you to receive help from who we got down here for you. You know what I'm saying? But until you can really face yourself or accept who you are at this moment, you can't see who you can become. You got to be able to speak the truth and accept the truth, and then go after the truth, and then become the truth that you see. You know what I'm saying? But that's just my take on mental health and just that world in a nutshell. I know this is a longer video than I usually do. Thank you for your attention. For those who watched this to the end, I know this was different. I know this was probably random, bro. But like I say, sometimes I'm unable to sleep. So instead of using my time to be destructive towards myself and others, I'm using this time to be progressive and constructive, and just be able to build myself and build others up, and just use this experience, every experience I have, in order to help somebody else. But that's just my take on what is mental health. Till next time, Slim.